OCD, obsessive compulsive disorder, is a type of anxiety disorder. Anxiety disorders are very anxious and fear may even become severe and create enormous trouble for a person. The certain areas of the brain appear to be affected. The serotonin imbalance that leads to OCD, you can see right there on the little graph, where it's mostly affected. This involves the pathways of the brain that link the area of the brain that deals with judgment, planning, and the area of the brain that filters messages involving body movement. It is a potentially disabling illness that traps people in an endless cycle of repetitive thoughts and behaviors. May cause people to develop certain types of rituals and routines in their lives, in their everyday life. Although the ritual may temporarily alleviate anxiety, the person must perform the ritual again when the obsessive thoughts return. They can't help it at all. Common symptoms: fear of dirt or contamination by germs, fear of being embarrassed or behaving in a social, unacceptable manner, repeatedly bathing, shower, washing hands, also having things in certain order, or symmetry, refusing to shake people's hands or touch doorknobs or anything like public where a lot of people touch, stuff like that. Here's a little video that I found that pretty much it kind of really explains it.
You can just go ahead and put this on and talk to you.
Shortly, how long is that? Hello? Hello? Well, Mr. Monk, it looks like everything is in order. Thank you. I did my best. Mr. and Mrs. Gruberman, your blood tests are back. You're pregnant. And so are you.
So there's a little video. I think what Monk, it's a show. I think he's like a detective or a police officer or something like that. But anyways, he's really good at his job, and probably the reason why is because he has a OCD. As you can see, where he had to put everything in a certain measurement. He arranged the sizes of the flasks and stuff. He needed to have the X-ray in the middle of the, I don't know what you call it. But yeah, that's pretty much scared of germs. He had to clean the telephone, stuff like that. They're usually really neat because everything bugs them. They just can't leave it. Like most of us will be able to leave something laying on the ground or have a crooked painting on the wall, and we could eventually get over it, but they can't. Population about 3.3 million adults and about 1 million children and adolescents in the world is diagnosed with OCD. It doesn't really vary. It affects everyone. It's not really. It's equal between men and women. It doesn't matter what race. It doesn't really vary from race it's all pretty even. There's no lab test to diagnose OCD. The doctor based his or her diagnosis on assessment of the patient's symptoms, and the brain scans work to those help out. Treatment. Obsessive compulsive disorder treatment can be difficult, and treatment may not result in a cure. Types of treatments are psychotherapy and medications. Psychotherapy, cognitive behavioral therapy. This therapy involves gradually exposing you to a feared object or obsession, such as dirt, and teaching you healthy ways to cope with your anxiety. Pretty much, they try to like help you face your fear, like little by little, baby steps, just so they could show you that it'll be okay, so you can get over it, or try to cope with it. Medication, antidepressants that have been specifically approved by the Food and Drug Administration to treat OCD includes clomipramine, fluoxetine, yeah.
Just say they are.
Yeah. Well, pretty tough to read. Anyways, so those are the main medicines they use. They also use non-label medicines that help, but these are the most recognized ones. Antidepressants may be helpful because they may increase levels of serotonin, which that is what the brain lacks and causes OCD. Side effects: some medication can have dangerous interactions with other medications, foods, or other substances. You need to talk to your doctor before you think of leaving your medication, because it could cause a relapse. And other side effects are like stomach upset, sleep disturbance, sweating, and reduced interest in sexual activity, which we don't have anyway, so. Other treatments, options: psychiatric hospitalization, residential treatment, electroconvulsive therapy. These are transcranial magnetic simulations and deep brain stimulation. These are the types of treatments they have. They're really not very popular, and they really haven't been enough tests on them to prove that they have a positive effect on OCD patients. And so people really need to know, because sometimes the first two, the psychotherapy and the meds, sometimes won't help, so they have to think of other treatments, like these are some of them. They really need to know the pros and cons before they try any of them, and the health risks that go into trying these. In most cases, OCD is successfully treated. It's not. There isn't a all-time cure for it. You just have to keep dealing with it, going to therapy and taking meds. You can't really get rid of it. But you learn to get to a point where you learn how to function throughout the day and be near normal functioning. So, here's my presentation, guys. I hope y'all enjoyed it.
Guys have comments?